You may not know it, but up to 40% of people in the United States live with the symptoms of an overactive bladder. This often stressful condition can be difficult to treat and even harder to talk about, but now a new Israeli company may offer a groundbreaking treatment. Joining us today in the studio is Avner Geva, the CEO of Vensica Medical. Thanks for coming in.
Sure.
I'm hoping I pronounced the company name correctly.
You did.
I did? Okay, I'm proud of myself. So let's start out, with talking about this disease. What is overactive bladder syndrome? I understand it's not something that people are as open about, but it is a very common issue.
Right, it is very common. So the statistics say, as you said, 40% of Americans suffer from this syndrome. And basically what it involves is a high frequency, so going to the restrooms even 3 times an hour. A lot of time it's associated with urgency, so the need to go right here, right now. But the worst symptom is losing control over the bladder, so just urine leaks, which is the worst symptoms that you don't want to have. And at this stage, usually the patients want to go and get treatment and discuss this with their physician.
And so I was actually reading about this online, and it says that 30% of men in the United States face symptoms of, it's overactive bladder syndrome, OBS?
OAB.
OAB, there you go.
Right.
And 40% of women face this issue, so it's a very big percentage.
Right.
Now, tell us about this product that you have created.
Right, so today the first line of treatment is usually oral medications where the patient swallows every day a pill, but more than 50% of the patients will fail oral medications because it has a very bad side effects. So really bad feelings associated with taking the drug during the day, nausea and sleepiness and some other bad feelings. And then the next line of treatment would be a very invasive treatment where a cystoscope and a needle are inserted into the bladder, and a drug is injected into the bladder wall at 30 different sites. So, and this drug is Botox.
Sounds painful.
It is very painful, as you can imagine. This drug is called Botox. It's actually the same drug used for aesthetics. And as you can imagine, it's a very invasive procedure, very painful. It's associated with risks that are the results of needle pricks. Blood and pain and 25% of infection rates as a result of this procedure.
But this is not the product that you guys are offering, right? You've created something else.
Right, so this is the standard of care. This is what's done today. And we have a special catheter that is made out of silicone. So it's really a silicone tube. Today even the person can insert this tube to himself or even by a nurse. So it's very, very easy. And the unique things about our device is that it doesn't involve needle pricks. So the catheter has an ultrasound transducer on the distal tip of the catheter that applies ultrasound to the bladder wall. And this is very different ultrasound than the one you know. It's not imaging ultrasound, it's for therapeutic purposes. And this ultrasound opens small pores in the bladder, and at the same time it pushes the Botox through these pores and deep into the bladder wall. So here we have a device with no needles, so pain-free or minimal pain. There's no need for any form of anesthesia. So in today's treatment, you must be sedated or be under some local anesthesia.
Right,
with this device, you don't have there's no need for anesthesia. Also, we reduce infection rate, no blood, no pain, and in general, we improve patient experience by a lot.
So that's amazing. Is this product available yet? Where can you get it if you want to get it?
Right, so we are expecting to commercialize the product in Europe by early 2019 and to take it in the US probably by early 2021.
Wow, okay,
Right.
but you guys are on the right path, so this is a really big deal. Now, I understand that there's a bigger business potential behind the product that you've created
Right.
because it can actually treat more
Right.
than just this
Right.
disease.
So actually, our company started on chemotherapy delivery to the bladder wall for the treatment of bladder cancer, which is actually, again, sadly enough, it's a huge market. It's the fifth most common type of cancer. And also it's the type of cancer with the highest recurrence rates. So it's like a chronic disease. And again, here our device improves the delivery of the chemotherapy, which today very inefficiently being delivered to the bladder wall. So again, there's huge opportunities because there are big pharma companies that manufacture those drugs, and they're very interested in our device. And we're having discussions with those companies for collaboration to develop our device for their purposes.
Wow,
Right.
that sounds amazing. Well, this is something that I've never heard of before, and it sounds great. And I'm very much hoping that it will be on the market.
Thank you.
By your projected
Right.
date.
It's important to stress that the Israeli government is funding this project alongside the private investors, but it's a big thing that
Wow.
the Israeli government puts a lot of money into this company. So
Yeah, and Israel, we're seeing this on a daily basis, is coming up with new medical technology
Right.
that's changing
Right.
the world. You're not, the first company to come in with such an amazing product, but this sounds very special and important for our future. So congratulations.
thank you very much, Natasha.